Let's get some analysis now from Sultana Begum, who is the Advocacy Manager at the Norwegian Refugee Council. She joins us now from London. Thanks so much for speaking to us. Sultana, are there solutions here? Because, as we know, Yemen was already declared a humanitarian disaster. So if the coronavirus hits, would there be any assistance for sick people?
I think firstly, just to reiterate what you've said in your report, that after 5 years of war, Yemen is ill-prepared to face a possible outbreak of the coronavirus. There are now millions of displaced people who are living in overcrowded conditions. They lack access to water. They lack access to healthcare. Simply washing your hands is a luxury, and you can't isolate yourself when you live in these conditions. So the Yemeni authorities are putting in a lot of work right now to prepare hospitals, quarantine facilities, as well as to inform the public about the threat of coronavirus. But as an aid agency which is working with people, extremely vulnerable people, what we're calling on for the authorities is that we can maintain our humanitarian operations despite measures being put into place to combat the coronavirus. So we still need to be able to provide food, cash, water, and sanitation to people who are desperately in need. And what we need international governments who are already dealing with their own, own issues with this pandemic to continue their funding and to help us scale up our work to prevent the coronavirus in Yemen.
Right, that must be a real concern for you, that this, global pandemic, which arguably poses less of a physical danger to people than those facing the conflict in Yemen, will now get a more disproportionate amount of resources because individual countries and the world's attention is so focused strictly on fighting this pandemic.
Yes, we're extremely concerned about governments diverting funding and attention away from Yemen when they're already dealing with this pandemic in their own homes. And you can see how this pandemic is even testing the advanced health systems of some of the richest nations in the world, and the challenges that Yemen faces with its health system decimated by the war. But we're really urging governments to stand with Yemen at this time of need. I think that Yemen has suffered 5 years of war. March 26th is 5 years since this war escalated, and there's millions of people in need. So we're saying to governments, now is not time to walk away, to stand with the people of Yemen and to help them get through this.
Right. I have to ask you, we heard UN Secretary General Antonio Guterres call for a global ceasefire yesterday in light of this pandemic. This is a bigger war. We need to fight together, he was saying. So warring parties need to put down weapons at this time. Do you think anyone would hear that in the Yemen conflict?
I think it's really important for the warring parties at this moment in time to put down their guns and bombs and to focus on fighting the coronavirus instead. I think what the UN Secretary General has asked for is an immediate need in Yemen. And so I think warring parties should heed his call.
Okay. Sultana Begum joining us there from London. Thank you so much for that.